February is American Heart Health Month and a time to raise awareness about heart disease, which is the leading cause of death for both women and men. Is that true? And for women, it said for women and women. For women, the risk increases during menopause, which a lot of people don't know. So joining me now is Dr. Priya Freaney, a cardiologist at Northwestern Medicine. Doctor, thanks so much for being here.
Of course, pleasure to be here.
You know, a lot of people, I think, still don't realize that there is a direct link between heart health and menopause. Can you explain why that is? Because it seems so unfair, frankly.
Sure, of course. So menopause is a big transition in women's lives, and what women usually feel is the hot flashes and night sweats and sleep disturbances. But what's happening silently in the background that we don't talk about enough is an acceleration of cardiovascular disease risk. So as the natural estrogen declines, cholesterol and blood pressure goes up, metabolism slows down, body fat moves to the belly, and we lose muscle mass. Our arteries stiffen. And all that taken together puts the heart in a much riskier environment after menopause.
Let's just talk about heart health or potential heart disease symptoms right now, and then I have a question about estrogen.
Sure.
Is there a way to differentiate between symptoms, let's say, of, you know, that could be related to menopause-related heart, I don't know, maybe palpitations if that's a symptom, or something already more serious?
There's a ton of overlap between symptoms that are typically attributed to menopause and the subtle symptoms of heart disease that can be presentations in women. And so the things you mentioned, palpitations, shortness of breath, nausea, fatigue, they need to be checked out. You can't just blame them on menopause. Sure, we might be able to prove that it's not something serious with the heart, but it deserves evaluation.
You mentioned the drop in estrogen. I know over the decades, and I'm not up to speed, there's been controversy. Should you do, you know, hormone replacement or shouldn't you? Where are you at right now in regards to estrogen, taking estrogen, and whether that will help your heart health?
Sure. You're right, it's been a roller coaster over the decades, but what we know now is that estrogen is not a cardiovascular drug. We do not have the data to say that taking estrogen should treat heart disease. We know that in the majority of patients, we can give estrogen safely if it's needed for menopause symptoms like hot flashes and night sweats. But we don't give it for heart disease. If you have heart disease or risk factors, you should be treated with cardiovascular drugs like cholesterol-lowering medications or blood pressure-lowering medications.
What is just some good overall advice for women in particular? You know, and I know women have lagged behind in studies and trials for decades, right? What right now should women need to know about how to keep their heart healthy? We know eat well, we know sleep, we know exercise, but maybe even something more specific before, of course, during and after, and maybe most importantly, during and after menopause.
Yeah, a few things. So before, during, and after menopause, women should really take charge of their heart health. Know what their heart disease risk factor numbers are: blood pressure, cholesterol, blood sugar, and weight. And if they're not ideal, make a plan to address them early and reassess them often. When it comes to exercise, in addition to the cardiovascular exercise the American Heart Association recommends we all do, women should be doing strength training. Muscle regulates metabolism, and women who go into menopause with higher muscle mass actually report fewer symptoms of menopause.
Oh, that's interesting.
And so I recommend all women do twice-a-week strength training and start early. At age 40, about a decade before the onset of menopause, start bracing yourself for menopause, but it's never too late either. Everyone should stay strong.
So even if you said, oh, that ship has sailed, no, it hasn't.
Never.
Get on that ship.
That's
and
right.
Exercise and lift weights and do all the things.
Absolutely,
All right,
yes.
Dr. Priya Freaney, thank you so much. It's such an important topic, and we really appreciate you being here this morning.
Great, thanks for having me.